at Health Direct, we started a transitions and care program, and I know a lot of pharmacies are thinking about or do some kind of transition and care.
Yeah.
It's a very big thing with Medicare A patients when you're working with typically a skilled nursing facility that has a lot of rehab. A lot of skilled nursing facilities invested in rehab because that's where the money is get rehab beds, get your Med A beds to drive profitability for a skilled nursing facility. So some of the skilled nursing facilities I worked with had beautiful, glorious, rehab facilities for your knee and your hip replacements and things like that. So it's not long-term patients. These are rehab, Med A, 14-day stays, and they're gone. They're back. They're out and on their own or in the community doing rehab at home from there, or coming into the facility to do rehab on like a day visit type of a thing. So the goal with that was trying to increase profitability for the pharmacy by capturing that next fill as they go into back home or back into the community. It's really a service because when a patient leaves that skilled environment, and you think about it, and if it's mom or dad or someone else, if the spouse is still living and driving, that's one thing. But often it's another family member or a son or a daughter picking up their mom or dad, and then it's like, oh, we have to stop at the pharmacy to get all these meds because they need everything, and it's just another hassle. And then do they have everything they need? How long do I have to wait before transitioning to that home? And part of that is the discharge coordinator and how effective they are at working with. Do they have a local pharmacy that they work with and collaborate with, or is it sent to where they've always gone or somewhere else where they might have to wait for hours on end? You've got mom or dad in the car.
It's like a meds to beds program, but for long-term care instead of the hospital.
Exactly. It's exactly that. Just like in the hospital situation where you're trying to ensure and just ensuring that they're not going to potentially readmit. It's a big deal for skilled facilities and for hospitals. If they weren't in there for a knee or hip replacement, or even if they were, what you don't want to see is that patient have issues or struggles and then readmit to the hospital. The hospital doesn't want that. Doesn't look good on the skilled nursing facility. They don't want that. More so with like a congestive heart failure exacerbation or something like that. But regardless, nobody wants to readmit. And one of the things that you can do is this transitioning care, make sure they have their meds available, right? And so that at a minimum, and we would get orders, deliver the meds in advance of discharge, and then give them an iPad to have a consultation with a pharmacist. So we were consulting them and talking to them about their meds, making sure they understood from the pharmacist's perspective, hey, do you understand what meds you're on? Did you get new meds while you were throughout your hospital or skilled nursing stay? Different conversations based on disease state and situations. But of course, ensuring that they had the most challenging thing with this transitions in care or meds to beds program is ensuring like last minute orders. So antibiotics, if they're converting from an IV to a PO or a IV to an oral med, if they're on warfarin and there's some tinkering with dosing, or they're waiting for that last INR to make a dose change, or if they have some controlled substance pain medications that they're going to go home with, having a physical hard copy. Because when you're doing a transitions in care program, those orders should look like community pharmacy orders. They're going to look like your traditional orders, and you're going to bill them differently and indicate them differently. But it's a great service. Facilities love it, right? So when you're working with facilities, they realize that this is a better care for the patient. They're focused on readmit rates as well. And also that service, hey, you don't have to wait. We're going to send these to the local pharmacy. We're going to just have them ready. And then obviously with a subsequent fill, they transition back to the community, to community pharmacy or wherever they might have. So it's just a one-time fill. It's not an ongoing traditionally relationship, although with LTC kind of looking at potentially at home.
I was going to say, so our last podcast, right, we talked about long-term care to the home, and that's where my head's going. Is it's like these transitions of in the facility, that sort of meds to beds transition of care, and then that long-term care to the home if it's appropriate versus, go back to a true community pharmacy. So it's interesting.
It is, And Lindsay, I watched that podcast. Yeah. Lindsay's great, and I years ago that was not the case, right? This is a new and evolving area, long-term care at home network, and those kinds of things to develop, and so go back 10 years and that wasn't a thing, right? We did one fill and we're done, and we let them go back
off
to the
you go,
community.
good luck. Right.
I totally agree. It's a great opportunity, right? For somebody who's looking at ways to increase revenue and drive script volume, what a great opportunity to say, hey, we're going to take care of this patient. And, oh, by the way, they qualify for meds at home through our pharmacy, so we can provide these additional services that they may or may not be getting in the community.